I'd like to welcome our subject matter expert on the call today, Rochelle Schultz-Benarski. I'm sorry, I always forget your first name, the first part of your last name. Rochelle is based out of St. Paul, Minnesota, and has been doing health and health systems related research for over 20 years. She has a BA in International Business Economics and German from the University of St. Catherine in Minnesota, as well as an MPA from, Rutgers University in New Jersey. Rochelle has conducted research and program evaluation for healthcare providers, nonprofits, counties, universities, networks, hospital associations, states, as well as national rural health research centers throughout the U.S. Welcome, Rochelle, and thank you for joining us. I'll now turn it over to you.
Great, thanks, Kiona. Hi to everybody. I'm Rochelle here with the red hat on. You can see it. Before we get started, given that I'm starting out with just this red beret, I thought I would share a little tip that I actually got from Kyle Cameron this morning, the Flex Program Coordinator in Wyoming. And Kyle shared with me that on your Zoom, if you are wanting to have a little beret like me or any other little tidbit to spice up your Zooming, I know a lot of you are coordinating and connecting via Zoom. If you go to your video icon down on your screen and you click that little arrow, you'll have both the virtual background option, which gives you the background like you can see that I have now, and choose a background for yourself. But there's also there may also be an option to choose video filters. And there's all different video filters back there. Oh, look at Kyle. She's got one on right now, if you can see her on the screen. So if you are doing your holiday virtually like I am, normally I host about 20 people, this year not. We'll be connecting virtually, and I will be tapping into many of these video filters just to make our engagement a little bit more interesting and even perhaps bizarre. So just a little tip to share with all you guys before we start talking about evaluations. And thank you, Kyle, for sharing that little tidbit with me. I totally love that. Let's see, Kiona, did you pass the screen to me? Did you share your screen so that I can open mine?
Andy, can you please help me with that? I think she'll need access to it.
Sorry, Kiona, can you repeat that?
She probably has it because I can share my screen.
Oh, perfect. All right, I do have it. Good, thank you. Thanks. All right, so hello to everybody. This is, as Kiona said, the State Flex Program and Performance Improvement Opportunities webinar. So it's great to have everybody joining us today. I am going to take myself off video here for a second so that I don't have any issues with sharing myself and my slides. Great to be with all of you. I know that most of our states have a very stressful COVID environment right now, so thank you for taking the time out of your day to talk about Flex program evaluations and performance improvement. As we work through today's webinar, please feel free to ask questions along the way. I think all of the lines are open. Kiona, can everybody unmute themselves if they want?
Yes, they do have access to that.
Okay, great. So feel free to just unmute yourself. Sometimes it's hard to break in, so you can use that raising hand feature, or you can also put a question in the chat box, and a bunch of us will be keeping our eyes on that in case you do have some questions. So just keep that in mind, that we are here and really wanting to kind of discuss and talk about performance improvement, but make sure that we can answer your questions as well. Something else to note is that everybody should have gotten the performance improvement readiness self-assessment in the meeting invite. I think Kiona was going to put that in the chat as well if you haven't seen it. But a copy of that is in your meeting invite. And this assessment aligns with what I'm going to be presenting today. It really can help you identify some evaluation opportunities, performance improvement opportunities, next steps for your program. The assessments are really for you and your team. But then also, we're going to be talking a little bit about some technical assistance that's available directly to you as well. And these assessments can be used as a part of that technical assistance if you choose to go that next step. So make sure that you tap into these to take a look at these. They're really, the assessment was really developed to support your FLEX program and thinking about performance improvement and evaluation. All right, so today's discussion, we're really going to kind of walk through these 4 steps. I'm going to start out with just an overview and some reminders of some past discussions that we've had. I don't know how many of you participated in the evaluation guide discussion that took place earlier. So I'm going to present a few just kind of reminders from that guide, talk a little bit about why performance improvement and program evaluations are important, go through some key questions that we talked about during that kind of guide discussion process, and then move and spend most of our time today talking about 5 performance improvement opportunities. And when I talk about performance improvement, I'm really kind of blending performance improvement and evaluation together. Most of our states and most of our programs kind of start on the performance improvement side, move then into evaluation, but I'm really kind of blending both of those concepts together as I talk today. All right, so first, as I stated, I just wanted to just make sure that everybody is aware of and knows that the FLEX program evaluation guide is out there. I have a link here on this slide, and these slides will be available on the TASC website. Kiana put a link in the chat box as well. But the guide walks through evaluation planning, evaluation methods and design, data sources for FLEX program evaluations, communicating your results, some conclusions, and then there are several attachments. And important in terms of the attachments is really knowing that there are some samples. There's lots of information about who some of the FLEX program partners and technical assistance available, kind of what's out there for you. But make sure that you take a look at the eval guide if you haven't done it already, because a lot of what I'm going to be talking about today connects back to some of the discussion in that evaluation guide. So why is performance improvement and evaluation important? We did talk a lot about this during the guide discussion, but just as a reminder, and if you remember from that training, we talked about this and that there's many reasons why evaluation and performance improvement are important. But the bottom line is that if we don't know our program and what is resulting from our work and its investment, both in terms of time, resources, et cetera, we don't really know whether we're having an impact and whether there is a need for program adjustments or changes. So really making sure that we know what's going on with our program, what's resulting from it, and how we should develop it. That's kind of the bottom line of performance improvement and evaluation. But all of these, understanding and increasing the impact, improving program efficiency, validating the program and our activity intent, all of these items that I have listed go back into why we're working on performance improvement and why we're working on evaluation. Also, as a part of the evaluation guide, I talked about different key questions to be thinking about as a part of performance improvement and evaluation. And all of these key questions are going to apply to the 5 key elements just to be thinking about in terms of evaluation that we're going to talk about today. I've included these key questions here just as a reminder because after today's session and after completing that performance improvement readiness self-assessment that I indicated when we got started today, I really recommend that you refer back to this list and use it to flesh out any action plans that you identify to really be thinking about your performance improvement activities and to be thinking about evaluation. Also, as you build and evolve your performance improvement plan, these key questions can assist you in moving from performance management to performance improvement and to evaluation. and as well as having the data you need to report the outcomes and outputs that you're going to be reporting as a part of your performance improvement process. So really using these key questions can help you drive your program forward. Another really important part of that eval guide discussion that we had earlier that I want to talk about also is just performance management and improvement. Now, for today's webinar, I'm not going to go into performance management and improvement really, and I'm not going to go into the details about what performance management, what performance improvement, what evaluation are. All of these concepts are described and defined in that eval guide. So again, I recommend that you go back to it. But it is important that you understand the concepts within performance management and improvement, that you understand inputs, process, outputs, outcomes. All of these items are talked about. All of these are defined and really are included as a part of the performance management and performance improvement process. So if these terms aren't familiar to you, look back into that guide so you can either familiarize yourself with the terms or even to just learn about them if all of this kind of performance management, performance improvement information is new to you. So although I'm not going to go through defining all of these terms, I will be using some of them during our discussion today. So it's really important to do some follow-up if you are not familiar with them. All right, so the Flex Program performance improvement opportunities, as I said, is kind of what we're going to be focusing on. And I'm going to spend the remainder of the webinar today talking about 5 performance improvement opportunities. All of these can be used towards performance improvement for any of the Flex Program areas that you're working on. In fact, it can be used across any of the programs that you're working on. It could be SHIP, it could be your State Office of Rural Health Activities. But I'm going to be really kind of focusing on Flex here today. And so the discussion will surround, and the examples that I use are going to fall into the areas that we spend the vast majority of our time on within the Flex program. So performance improvement related to quality improvement, financial and operational improvement, EMS, population health, and other. All of us are working in these areas in some form or fashion. So all of the performance improvement evaluation concepts are going to apply to these 5 areas. Something else I want to say before we get started is just performance improvement and evaluation. You're going to note as I talk through the kind of 5 key areas that there's going to be a theme. And the theme is going to be data. I hope that as you kind of listen to some of this discussion today, that if there's anything that you walk away with, it's going to be the value of data. Because we can't do performance improvement, we can't do evaluation if we don't have data. So if you walk away with anything, I really hope it is that data piece. And all of the opportunities that I talk about are going to have a data component. So again, then also if you refer back to that readiness assessment that's available, that also has a data theme to it. Finally, the other thing I'd like to note is that, and this wasn't stated in the introduction, is that I do work directly with state flex programs in Wyoming, California, and Louisiana. And I'm going to use some examples today in terms of talking about some of these performance improvement concepts. And all of the examples that I'm presenting are from one of these 3 states. So they're all live examples. They're all things that can be applied very easily in any one of the states that are out there. All right, so I'm going to start with opportunity number 1. And I think this is the most important opportunity for performance improvement, and that opportunity is to get started. Getting started doesn't mean that you have to evaluate everything all the time, have all the data, analyze all the data, even use all the data. It just means that you start, and this may mean that you start small. It may mean that you start in one area, you may start with one or two objectives, but when you think about performance improvement and that you think about evaluation, it can sometimes get really overwhelming, and we can kind of spin in what we have or what we think we need to do. But if we can just get started, then we can get some experience under our belt, and we can start using that as an opportunity for us to then move into other areas of our program. So as you're moving forward and as you're thinking about evaluation, I think the most important opportunity is to get started. When you're thinking about getting started, there are some key considerations or some questions that you can ask yourself in terms of setting some priorities. So regardless of where you're at in your entire process, whether you're at the beginning of doing performance improvement, you have some performance improvement under your belt and you've been doing some performance improvement work over time, you may have even stalled out on performance improvement because you've got a lot of other initiatives underway and you're trying to do a lot of activities, and so you've kind of haven't paid as much attention to your performance improvement work. Wherever you're at, there are some key questions, some key considerations that can help you in determining where to start, where to set priorities, or where to get started again. So some of these kind of questions that I would encourage you to ask yourself are, where are you spending your flex resources? Whether that's human resources, so where you're spending the majority of your time, where you're spending a lot of dollars. It could be in the form of contracts. It could be in the form of funding that's going out to your critical access hospitals. Where you're spending your money, that could drive some of your priority setting in terms of determining where you're going to focus your attention. You may also want to think about where can you have the greatest impact and measure results. I am big into the path of least resistance. And you may find that there are some places that it's just easier to get started, and where you feel like, wow, I can get good bang for my buck here. And so you decide to start there. You may also have places where you need to make the most amount of decisions. So where do decisions have to be made? Do you have program components where you're trying to think about, do I want to continue this part of my program? Do I think this part of my program is having an impact? Is my funding resulting in what I was thinking it was going to do? Am I moving the needle in the direction that I was hoping I was going to move in? All good questions to be thinking about in terms of getting started. And then finally, what can you or are you measuring already, and where do you have access to data? Again, this path of least resistance, where do I have data that I can easily pick up and rock and roll with in terms of doing the performance improvement that I want to do? So any and all of these questions can be a part of your performance improvement development process and are particularly helpful when you're just getting started. Opportunity number 2 is MBQIP data. And MBQIP data, and I should note that these are, other than opportunity number 1, getting started, none of the opportunities are in any particular order. So you really think about these questions here in terms of getting started, and many of them are going to help you make the decision in terms of what your next step should be and what other opportunities are most important to you. But I have listed as opportunity number 2 is MBQIP data. As I noted, I work in 3 states, and each state has performance improvement activities that are different and are at different points in the development process. But for all of us in all of these states, and in fact in all of our states, we all have access to MBQIP data. So it is a great opportunity for all of us. A couple of other reasons why MBQuip data is going to be really helpful and is a good priority for all of us. As I already said, we all have MBQuip data. We all have many years of MBQuip data for most of our CAHs. Many of our states haven't had hospitals convert to critical access hospital status in several years. So we've been collecting data for most of our CAHs for an extended period of time. Another reason why MBQuip data can be really easy and helpful to use is that we have access to tools that can assist us in organizing and analyzing this MBQuip data for our performance improvement process. And tapping into those tools can easily help you manipulate it and use it. We also have a lot of benchmarking data for our MBQuip data. So whether it's the Telligent, and most recently we have the Flex monitoring team reports, all of these reports have some level of benchmarking data within them. Also, the Flex program and the Federal Office of Rural Health Policy are using funding on MBQuip data as well as us. So we know that the MBQuip data is a huge priority for them. And then finally, we often hear, it's not for sure, but we often hear that critical access hospitals may eventually be paid based on quality and or their MBQuip data. So this could be a really good reason to use it as well. So how do I use my MBQuip data when I'm thinking about performance improvement? First of all, really, think about what those questions are and what you want to answer, but understand why improvement should occur. If you're looking at your MBQuip data, are your hospitals below national benchmarks or expectations? Do you have little participation? Are there some measures that are of more interest to critical access hospitals? So really look and understand your data. Set some objectives for your program and be using your MBQuip data to drive what those objectives are. Organize your data. And you may want to use some of the Archita tools in organizing your data, or you may have something internally that you're using to organize your data. You can track changes and report those to stakeholders. And then, of course, you want to use your findings to determine what the outcomes are, make any of your program adjustments, and then better target program activities. I've got a couple of examples, and I wanted to point out a couple of things that are really important about the MBQuip data to consider. First of all, with the EDTC data, that's a really great place for anybody that's really starting is to use your EDTC data. And part of that is because you get that data directly. So you're not waiting for any EDTC reports to come back from the Flex monitoring team or anybody else. You get your state data right away, and so you can use it right away. You can use it from a statewide basis. You can group your hospitals into cohorts depending on what's going on. You can tackle things individually, and then you can track all of this data based on what you already have. From an outpatient standpoint, depending on what your program looks like and what your critical access hospitals are reporting, the states that I work in, we really focus more on the outpatient side on cohorts and individual critical access hospitals because we have very few hospitals reporting some of this outpatient data. So we really use it in the way, and we can track things in a way that's going to be most helpful to those hospitals that are reporting data. HCAHPS, again, you should have statewide data. You can do that in terms of cohorts and individuals, and antibiotic stewardship data, again, statewide cohorts or individuals, depending on what your data looks like and who's reporting what in your state. And we're all going to be a little bit different. So really thinking about what makes sense for your state is going to be key in terms of being able to use this data in the best way possible. I put up an example for the MBQuip data, and I used antibiotic stewardship. This may or may not be a priority for your program, but if it is a priority for your program, there's different questions that you can ask yourself in terms of your performance improvement, doing some evaluation work. So for example, are 100% of the critical access hospitals responding to the annual survey in your state? They may not be. If no, what's your objective? Are you trying to achieve 100%? Are you trying to get to 90%? It'll really depend on your state and where you're at. Another example could be, are 100% of your CHs meeting the antibiotic stewardship recommendations? If not, where do you want to start? What are your objectives? Are you trying to get to 85% of your CAHs meeting those ASP recommendations? Are you trying to get to a certain percent meeting all of those recommendations? Really think about what your data looks like and what you're trying to achieve and what's reasonable. And then from a data perspective, are you going to use the Flex monitoring team and equip data to track reporting compliance and where your data is at? And any changes in your measures? Will you need some interim data from your critical access hospitals directly that you'll be tracking over time from a reporting basis? And then how are you going to track this over time for your CHs, both in terms of the changes that are being made, but then also who are you supporting in terms of moving these measures in the direction that you're intending? Now, one thing I should note is you'll notice with that last item on there, do you or how are you tracking the data related to CHs who received support or who did not? It's really important to track that because you need this information in order to determine whether the work that you did had any impact on the changes in the data that you're collecting. And sometimes there's going to be some outside work that's taking place that may move these measures in some direction or another that may not relate to what you actually did. But if you don't know who you helped where, there's no way to make a connection back to what you did with any of the changes that you made. So it's really important to have both the information on the work that you're doing, which is going to be your any of your process and your process measures that you're working on, but then also and your output measures, but then also all of the movement in the data that you're collecting related to antibiotic stewardship itself. So that's just one example for MBQuip of what you could be working on from a performance improvement standpoint. And this is just antibiotic stewardship, but you could apply this concept to any one of those MBQuip components. So I'm going to take a pause there. I think MBQuip is such a big piece to the Flex program, and all of us are working on it. I'm just going to take a quick pause to see if anybody has any questions or if you have any ideas that you want to throw out there for others that you'd kind of like to share related to antibiotic stewardship. Any questions that people have or any comments that you want to make? All right, I'm going to keep going, but I'm assuming that everybody is. Oh, Scott. Thanks, Scott. Scott says small populations. Yeah, you know, one of the challenges, and this is actually, I really like the fact that you mentioned that, Scott, because we actually run into that a lot just even on our quality improvement efforts that we're doing in terms of small numbers and small changes, et cetera. So, and you, I don't know how many critical access hospitals you have in Hawaii. I want to say like 7 or 8, maybe you have a couple more. But yes, your numbers are really small. We talk about that a lot in Wyoming as well, since we have 16 critical access hospitals in Wyoming. To be able to move that needle, it can be really super challenging. But even in telling our story, if we have a story where we are only working with one critical access hospital, we can still tell that story for that one critical access hospital in terms of where they started with their baseline and where they moved to. Same with if you have 3 hospitals. Where did that group of 3 hospitals start at the beginning? So what was their baseline and where did they move to? One of the things that I notice a lot in terms of using my MBQuip data, and a perfect example would be California, where we've had a number of critical access hospitals, not a number, but we've had a few critical access hospitals come on board in the last 2 years as critical access hospitals. So while we've made progress in most of our CHs with our MBQuip data, we recently with EDTC had a group of new critical access hospitals come on board. And with EDTC, their compliance with those measures was close to 0, which really drags our statewide scores down in the averages that we're tracking over time. So we've changed or adapted, I would say, some of the ways that we're looking at our data and improvement. And so, for example, not just looking at averages, but a big measure that I like to use is the number of hospitals that are at or above the national benchmark, and then using that number over time so we can actually see our trends in terms of overall numbers. So I think it's really important to look at what you're working on and then thinking about, okay, how can I show this change even if I do have small numbers? And I would be, this is something that I think you just really have to tap into and really think about, okay, how can I reflect this change, even if it means that it's only for one critical access hospital? A good example of what I even talk about with critical access hospitals themselves and changes over time. One of the measures that we have worked a lot on is falls. And for a number of our facilities, they have no falls, and but then suddenly they have a bunch of falls, and a bunch of falls for them may be 2. And so their numbers are so small when we're looking at averages, et cetera. So instead of tracking their average number of falls, we track the number of months between their falls. And what our aim is to have our objective is to have more months between any one fall. So that's the way we were able to think about that data and those low numbers as we were thinking about it over time. So using different concepts to tackle data depending on what measure you're trying to use, I think is going to be key with using that MBQIP data with small numbers. Tracy also put a couple of, and Natalia put a couple of suggestions in the chat box again. Jill commented about challenges in getting, I think, IHSCH's reporting. Jill, can you verbally kind of state that one? I don't know if you've got voice capabilities on your computer.
Yeah, can you hear me? Because I lost the pictures. Can you hear me?
Yep, we can.
So our Indian Health Services is IHS, if you were unfamiliar with what that was. One, they don't want to publicly report. I do have one that is, and 2, they do these other measures, GPRA measures, and some of them overlap and some don't with MBQIP measures, and it's always a challenge to just get them to report MBQIP measures.
Yeah, so unfortunately, others sitting around the table may have some ideas in terms of getting IHS hospitals to report. I think it's probably a similar situation with some of our hospitals that are a part of a system. I know the states that I work in, a lot of our system hospitals don't want to participate in MBQIP. For those, we just continue to follow up with them, encourage them to report, and find other places where we are maybe working with them, where we can include them in our performance improvement efforts. That will be an ongoing challenge. And sometimes it's not even as, whether they're a part of this system or that system. I find that it is just it depends on the person who's in charge of that particular facility. So, we have some, for example, system hospitals where they say, yeah, we're going to do it in that exact same system in another state will say, no, we're not going to do it. So a lot of it just comes down to personalities, and maybe there's a staffing change and people will say, yeah, we want to get on board. But I would look for other opportunities and other data where you can tap into and really be working on performance improvement with them.
So for instance, if they are doing immunization measures, but it's reported through a different system, I don't necessarily, I know where I can find data, but it's not reported like the same way as we get MBQuip data. It goes through this IHS reporting data system. So it would be hard to sort of do any improvement activities around that.
Yeah, so something to think about, and others may have this similar challenge, is you may want to track their data if it's not exactly the same. You may want to track that data, but do it side by side and don't aggregate everything because the measures aren't apples to apples. They're kind of Granny Smith to Pink Lady. They're a little bit different. So make sure, do track the data side by side and changes over time, but don't aggregate that data as a part of your tracking process. The other thing that I would add, and it goes back to that getting started slide that I had, and some of those the arrows of kind of priority setting, is really, I really encourage everybody to focus on tracking data and focus on performance improvement that aligns with the activities that you're working on. So I use the example of MBQuip, knowing that we're all working on MBQuip, but some of us are working more in some areas as compared to others within MBQuip. So it's really important that you focus your performance improvement activities on the activities that you're actually working on. And if, for example, immunizations is a huge priority for you, then find ways where you can be tracking that data simultaneously over time, even if the data is just a little bit different, because you can be telling the same story and report that out in using a couple of different pieces of data in order to reflect the changes that are taking place across all of your facilities. Somebody made a comment about real-time measurement. It's hard to reach out from a reporting standpoint, and that sometimes people miss reporting. Definitely a challenge. That's what makes EDTC pretty slick, since we can see it right away. The only thing you can do is probably build in if you have discussion groups with your critical access hospitals to find out who's reported or who hasn't. But having that delays and knowing who's reported, who missed the reporting, is definitely a challenge. In fact, I just recently ran into that with HCAPS, had thought all the hospitals were reporting, got the Telegen report back, saw one hospital's data was missing. They are reporting, but for some reason, their vendor hasn't been sending that data to CMS. And so now we're going to have potentially a lag of 1 year before that hospital's data is going to show up again in the Telegen reports, even though they are tracking that data. So yes, a challenge, but note the outlier, and continue then to work on all those other hospitals and be tracking that data over time. All right, so if you have any other questions or comments, put those into the chat box, and we are going to move on to opportunity number 3. So opportunity number 3, is all other data. All other data that we have access to is also an opportunity. So while I initially focused on MBQuip, you can use that same concept, the same kind of philosophy for any other area that you're working on. For some of our flex programs, I know that financial improvement and operational improvement are really big priorities, and that's where you're focusing your time and resources. So that may be where you want to focus your performance improvement work. Why is this an opportunity for you? We all have access to other primary and secondary data that applies to these other areas within our Flex program. So again, the Flex monitoring team has resources that are available to us. Some of you may be collecting satisfaction surveys as a part of your program. Some of you may be collecting participation data as a part of your program, pre and post test scores. You saw at the beginning of this webinar that it wasn't a pre-test, but just kind of a little assessment was done in the beginning. There's going to be another assessment at the end. Community health needs assessments are being done, and some of them are supported by Flex programs. You may even have past evaluations or case studies that you've done that you can use as baseline data for future work that you're doing. There are a number of states that have done some pretty significant evaluations in the past. Some have done significant case studies for their individual critical access hospitals. Any of this data could be tapped into in order to use it as baseline data to track program activities and accomplishments over time. It really depends on what you want, what you want to focus on. And really with all of these, if you're already collecting it, or if you can easily collect it, it really does create easy access for your program. So again, this is the kind of how part of it is no different than what we were talking about from an MBQuip standpoint. Really know kind of why improvement should occur. Again, are you below the national benchmark? Do you have expectations? Have your critical access hospitals set expectations? Is there a lack of participation? Is there a certain amount of interest by critical access hospitals? Set your objectives, organize your data, track your changes, make sure that you report any findings or information out to stakeholders, and then use these to make all of your findings to make program adjustments, better target your program activities, just make program changes over time. Some examples of where you might be collecting this data or organizing this data from could be in workshops, training, technical assistance that you're providing, grants that you're giving out to critical access hospitals or other organizations. So many places you can be collecting these data over time. Again, I have a couple of examples in terms of this data and how you might want to use it. So some of you may be doing some kind of a trauma training, skills improvement training, and you may want to assess the initial impact of the training. So you may have a pre-test versus a post-test score. If you remember for any of you who participated in the eval guide discussion that I did, I talked about some pre and post-test scores that we do for rural trauma team development courses that we put on. Do a pre-test for all of the participants, and then we do a post-test for all the participants. You can do a post-course survey. When you do post-course surveys, it's really important not to just focus on, are they satisfied with the course? Was, the room a good space? Logistical things like that. Those things from a performance improvement standpoint really have a lot less value than understanding, is the information going to be helpful? What did they learn and how are people going to use it? And in the eval guide, there are some examples of some survey questions and tools, so you could tap into some of those there. After you've done some of that pre and post-course survey, some 3 to 4 month impact follow-up, really follow up on some of those questions that you asked in the survey. Did they actually do them? Did they change their process? Did anything change in the critical access hospital? And then if you're doing any of your training, any of your skill improvement trainings over time, there's a huge opportunity to really look at a multi-year impact. What was the difference between your past post test versus the pre-test for the current course that you're going to be putting on? Any multi-year impacts, any changes in sentiments that you can be tracking over time from year 1 through year 5 and the different training that takes place will really be a good indicator of whether this is having any kind of an impact organizationally in your critical access hospitals. Another good example is revenue cycle training towards, for example, decreasing days in accounts receivable. there could be any financial measure that you could choose and put in here. For days and accounts receivable, I chose that one. But for example, if you're doing a training, who's participating, what did the training provide, when was it provided, what kind of technical assistance, TA, was provided as a part of that training. What was the number and types of internal process changes that occurred as a part of that training that folks participated in? What was the change in terms of days and accounts receivable by the participants? You may want to do a pre and post test in terms of anything that was supposed to be learned as a part of the process. Or you may want to report and track change in denied claims or some other measure. Important with a lot of these trainings that relate specifically to finances is getting a pre score for folks, and then tracking any changes that take place over time. So you need to know who's participating, what's their current status, and then track those changes over time. See a comment in the chat. Okay, thanks, Kiona. All right, so any questions about that last opportunity? All right, we are going to go to our next opportunity, and that is lead by example, and this is opportunity number 4. And I include this as opportunity number 4 because it relates directly back to what we ask our CAHs to do as a part of our Flex program. And honestly, I feel like, from a Flex program standpoint, this was kind of where everything here for me as the Flex, working in the Flex program for many years, and really, connecting all of the dots of, why this is so important for individual Flex programs, how this ties back to the critical access hospitals, and all of the work that we're doing. But what we're doing as programs is, as a part of our performance improvement process, is really very similar to what we ask our critical access hospitals to do as a part of the Flex program. So we're only doing what we ask others to do. And it really is, when you think about quality improvement activities and the Plan, Do, Study, Act PDSA cycles that most of our critical access hospitals are participating in, your performance improvement cycle is very much the same as what they're doing as a part of their quality improvement cycle as well, or their financial improvement cycle, or their operational improvement cycle. Now, from our standpoint and what we're doing as a Flex program, all of us are doing a really great job at planning our activities and doing our activities as a part of our program. And then if you look at the slide, the items that are in green, some of us are doing some of those other steps a little bit more than others. Some of us have really mastered that, and some of us aren't doing any of that. So it's really completing this PDSA cycle from a Flex program standpoint. So planning your activities and knowing the data you'll need at project start, doing our activities and collecting the data, analyzing the data, talking about it, reporting it, sharing it with our stakeholders, and then using the information to make program changes, make program improvements over time. This PDSA cycle is the same for us as it is for our critical access hospitals. All right, the final opportunity that I'm going to present is opportunity number 5, which is connect with those who can support performance improvement. As a part of the Flex program, we have a number of support organizations out there to support all of us with performance improvement and evaluation. And I'm assuming some of you tap into these organizations, some of you may be newer to Flex. Sometimes it's just easy to forget who's out there to support us with all of this work. I should note that with all of these organizations that are on here, they can support us with so many of our State Office of Rural Health activities that we're doing, but all of them focus on Flex, and most of them also focus on SHIP. So, you know, depending on what programs you're working on, they're all good resources to tap into as a part of this process. So Task, I think everybody's familiar with Task. They're hosting this webinar today. They have ongoing technical assistance available to everybody. Tracy's going to talk about some TA that I can provide all of you directly as a part of this training process. But they also have data, reports, tools, samples, guides on the Task website, including that evaluation guide that I talked about. The Flex monitoring team provides some data and reports. I'm going to show you some samples that they have available that we can all tap into. The Rural Quality Improvement Technical Assistance team definitely has data and reports that are available to you. And in fact, most recently, just an example of how I tapped into Arquita was we have been working on antibiotic stewardship in Wyoming. And so Arquita put together a Wyoming specific training and tool and data for our Wyoming Flex program, did a presentation. All of that is data that I can tap into for evaluation purposes and use as a part of the Flex program evaluation activities. The Federal Office of Rural Health Policy is always available for guidance and direction. Their team is very dedicated to performance improvement, getting all Flex programs headed in that direction. The Rural Health Information Hub has tons of data, reports, tools, samples, everything that we can tap into, especially a lot of data and reports related to any benchmarking data that you're looking for. And then I've found that other state Flex programs always willing to share what they're doing, to share information and resources. So don't hesitate tapping into other state Flex programs. In the evaluation guide, I include some examples of some state Flex programs that have evaluation materials on their website. And so you can even look at those tools and see what they have available that you might be interested in. Real quickly here, I want to share the FMT example. This here is in the slides. If you go onto the FMT website, you can tap in your state name. You can pull up a profile of all the Flex monitoring team reports and data that's available just to your state. And those are all resources that you could use for your Flex program performance improvement and evaluation, and just data and resources that are really good and can be really helpful. All right, so that is the end of my 5 tips for all of you that you can tap into for performance improvement. I want to thank everybody for joining us today. And I think I'm going to turn it over to Tracy, who's going to talk about kind of a next step that you can all tap into to get some direct TA beyond what I just presented this afternoon.
Thank you so much, Rochelle. That was a lot of information, but it's always really great to hear it. I think evaluation is clearly a gigantic topic. Hopefully the evaluation guide that Rochelle was referencing, you've read it or you're familiar with it, or if you're not, now you are. The purpose for today was really to kind of get the wheels turning about what are opportunities within your program to support your performance improvement and evaluation. Just knowing that there's always something to work on and it shouldn't remain stagnant. So hopefully the self-assessment, you either completed it before, or you're planning to complete it after this call here, or you are following along. But it's really meant as a starting place to identify what your opportunities are. And so with Rochelle, we're really excited to be able to offer to the State Flex programs a chance to have a one-on-one coaching session with Rochelle to dive deeper into some of the items that you might identify in the self-assessment about opportunities for your program within performance improvement and evaluation. So the way to request this would be to contact Task through our email address is just task@ruralcenter.org, or you can reach out to anybody on the team, but that's the one spot that everybody will see it. So go ahead and send us an email, let us know that you're interested in it. And so what we'll do then is connect you directly with Rochelle to set up a conversation, and likely it'll be kind of a couple conversations where she'll walk you through some of your pain points that you maybe have identified, talk further about action items you might want to take and share some resources too. So it's a great opportunity to get some one-on-one advice. We would like programs to reach out to us starting today for that, and we'd like to wrap up these series of calls by the end of the calendar year, so by the end of December. So again, if you want to contact TASK directly, then we'll coordinate those under the subcontract that we have with Rochelle to offer this to you. But again, you can reach out at any time with any questions, concerns you might have. We're happy to help you out with that. So please take advantage of this opportunity. I think it's a really good one. And with that, then I'll turn things over to Kiona to kind of post the last polling questions for you as part of our evaluation here at TASK, and then also some updates and reminders about some upcoming activities.
Perfect. Thank you, Tracy. And thank you, Andy, for pulling up those polling questions. So as we close up today, we have just a few questions that we would like for you to answer. The initial questions will help us measure the level of knowledge gained from participating in today's event. And then additionally, we would just like to know if you've learned anything that you would like to implement within your project, as well as your satisfaction from today's event. So while we close up and you answer those last questions, I'd like to share just a few upcoming events that are noteworthy. By the end of the month, there will be an update on the COVID funding resource guide. Please be on the lookout for this resource. As well, your end of the year reports are due at the end of November, so please follow up with your PO with any specific questions or further details that you may have. December 3rd, we will be hosting an MBQuip VKG, and the topic is MBQuip data reports and how to make use of them. The 2021 Flex Fundamental Guides is being finalized, and it will be sent out to the Flex offices as well as available online in the near future. So please be on the lookout for that as well. And then lastly, we will be holding a holiday special virtual knowledge group on December 17th. This discussion will be around Flex staff engagement, wellness best practices, employee satisfaction. So save the date will be sent out tomorrow on November 24th. So please be on the lookout for that one. We're really excited to provide that one for you. I know Caleb is super excited about it. So as always, we encourage you guys to reach out to us at TASK with any questions that you may have. And thank you again for all of your participation. Have a great rest of the day and a safe and joyful Thanksgiving holiday. Thank you.